Alright, so these are the body blades. This is a great tool for the rehab process to help stabilize and strengthen your upper extremity as well as your core, and help with some proprioceptive and even some balance stuff. So these blades are essentially carbon fiber with some grip in the middle, that's rubber. So for these blades to work, there's a little bit of science in it. So the rapid contraction technology comes into play. So as you are flexing the blades, you're having to contract your muscles at a quick rate. So it can go up to 270 contractions per minute, and that is kind of what helps stabilize some of those internal muscles, help those muscles to be strengthened and to get stronger. So as you're looking at a body blade, there's different types, different sizes. So the biggest body blade that we have here, as you can see, it's fairly long, and it's going to provide the most resistance. So the smaller you go, the less resistance, the bigger you go, the more resistance. And it's also important to realize that with each of the body blades, you can vary the resistance based on how fast and how intense you're flexing the body blade. So it's also important to realize that there are more body blades, more types of these, more lengths than just the 3 that we have here in our clinic. So this is the light, this is the classic, and this is the pro. So there are also smaller ones and longer ones. So the cost of these body blades can go up from about $60 for a smaller, lighter one to up to $200, $300 for a larger one. And they come in packs, so we can get 3 of these packs. 3 of these for about $300, $350, depending on where you're looking. So that's also an important piece of it. So I'm going to have CJ come demonstrate a little bit about the body blade and how to use it. So as you're looking at one of these, there's a grip in the middle, and it's important to vary that grip based on your desired effect. So there's a single grip where you can go over, under, underhand. You can do two hands here. As you're flexing the blade back and forth, you can go underhand as you're flexing here. You can also go on top of each other, side and side, having to kind of stabilize the core a little bit, trying to not move your body as much, but just move the blade. So there's also a laced grip. So depending on the exercise that you're trying to do and the certain muscles that you're trying to fire within the shoulder and the back and the core, even the legs, the grip varies. So also the stance of your legs, stance of your feet are important. So you can have a staggered stance as you're going here. You can have a narrow stance in the middle. You can have even a kneeling where you're going on one knee, and some of that varies with again the exercises that you're doing to strengthen, to stabilize. It's important too to realize that this is a low impact blade, so it's pretty light, and you can do a lot with it without putting a lot of stress on the joints. So they actually did a study showing that with the body blade, they compared the body blade and the dumbbell exercises. So they would have somebody do shoulder exercises, and they compared the muscle contraction activity within each of the groups, and found that the body blade was actually more effective in stimulating muscle contraction, and the strength of muscle contraction were stronger in the body blade than the dumbbell. So that's important to realize, that even though you're not lifting a ton of weights, you can still have similar effects using the body blade. So now CJ is going to show a little bit of the normal, what you'd say is the normal, what you've probably seen of the body blade. So just a normal side-to-side movement here. Yeah, you can do it front and back on the different planes of motion. So this is just isolating some of those movements. It's also important to realize that you can do some core. So I'm going to have you sit down on the ground as if you're in a crunch position a little bit. Yep, and I'm going to have you go back and forth. Perfect. So as he's doing this, he's having to stabilize the core as well as engage some of those back muscles and the shoulder muscles to keep the blade where it is, but also keep himself engaged as a whole. So this is a great exercise for that. You can relax. Another exercise we can do for this is more of a sport-specific exercises. So I'm going to have you stand up. Say we have a baseball athlete. I think sometimes you're like, oh, you can just do those movements, but you can also do like a throwing movement. So as you're going here, going through a throwing motion through that, while still maintaining those smaller contractions as you're going through. Another one would be a golf swing. So going through and swinging a golf club as if you are swinging a golf club, but you're still having to stabilize a little bit more through that. So those are some key components of the body blade, and again, he can change those, change the resistance based on how fast, how intense he's flexing the blade. I can take that from you. Next thing we're going to talk about is the slide board. So this is your slide board here. So on the front we have a slick surface, so usually made out of some sort of plastic or fiber here. So you have this, and on the back is a non-slick surface. It's important to put it mostly on carpet. It's recommended on carpet instead of tile, just so that you can make sure that the board itself doesn't slip as we are exercising on it. The patient is exercising on it. You also have these bumpers on the ends that will lock into place. So if we take this off here, these have little knobs on them that go into the ends of the board and just clip on fairly simply. Once we get this here in the place we want it, we just slide the bumpers on so that we can use them as part of our exercise regimen, pushing off. We also have the booties that will help the athlete slide correctly on the board. And you can get wax or some other lubricant to help that sliding process as well. For this board, it is useful in the clinic for balance, power, lateral movement, speed, agility, some proprioceptive and neuromuscular effects for it. The most important thing is to realize that there are other things besides just skating on the slide board. So I'm going to have CJ come and show a little bit of some exercises. So I'm going to have him put these on. Too small. All right. There we go. Got that on there. So as he's putting them on, you can get these slide boards for different prices based on the quality of the board and the size of the board. So it ranges from about $100 up to $500 or $600, just based on, like I said, the size of the board, the shape of the board, and the slickness of it. You can also make them yourself if you wanted to do that, but that would be a little bit more challenging. So for this, I'm going to have him show a little bit of just like a skating side-to-side movement. Very slick. Yep. So as he's skating, he's having to engage some of those muscles, get some power and speed in there, as well as balance on there. So you can stop there. Another good exercise that we might not think of is a lunge. So I'm gonna have you step off with one foot and go into a lunge as you are. Yep. So having to control that motion, a little bit more of the eccentric motion, and balancing with that as well. So you can do it one foot on there. If you step both of your feet on the board, good. And then go into the lunge again, having to again balance. So this makes it a little bit more challenging in the sense of both extremities being unbalanced and having to adjust with that. So those are the type that we think of when we think of the slide board. But another one, you can take those booties off and actually put them on your hands. So we can actually do some of the exercises on our hands to help coordinate some of the balance of stabilization in the shoulders as well. So I'm going to have you put those on your hands and give you a little bit more space here. Go here. And I'm just going to have you go into a push-up position if you can. Go here. Alright, I'm going to have you go into a push-up position. Good. And go down into a push-up. Good. So just having to stabilize a little bit more of the shoulders. Yep, wide grip. It's also, yep, you can do flies. So going all the way down. Good. Got a little workout in there. You can also do wax on, wax off. So a little bit of that shoulder, opening up some of that space and creating some balance and stability in there. So the slide board obviously can be used in many different ways, and is useful in the clinic for that. It's a little bit more low impact than just going on, going for a run or some of that to stabilize some of that speed and agility stuff. So it's also maybe a little bit different for some athletes. So you're not doing the same thing over and over again. If they're a basketball athlete needing to work on agility, they can come and do some more sliding and stuff like that. So both the body blade and the slide board are both tools that we can use in the clinic to benefit our practice and to provide the best care for our athletes and patients, and should be used as we are in the rehab process.